How about mentioning the separation of file? I was talking to you the other day, and you gave a very beautiful
Yes,
and
yes.
hilarious
Yeah.
example of a wife and father-in-law.
No. See, a separation of file is a nightmare for all of us. For even for a general dentist who does a root canal therapy, especially more so for an endodontist. If you separate an instrument and go back home, you won't even sleep in night. So the separating instrument is a nightmare for an endodontist, which can happen to anybody. It is a mistake which can be due to various reasons, due to the overusage of the same file. Nowadays, even though we have so many new technologies, new gadgets like endomotors with built-in apex locators, endomotors with a beautiful torque and specific torque for each instrument, speed for each instrument. Even then, we tend to do this mistake. Separation of file is bound to happen in anyone's hand, but it is always best or better to explain to the patient that after that happens. We have to tell them by ourselves. We have to educate them that this is what happened and it's just a mistake, and it is not something which can be it has to be explained in a proper way so that it doesn't harm both the patient and the clinician in any form. But you should show them the radiograph where it is broken. Yes, if it is broken in a coronal third, we can try to retrieve it. In the middle third, it is difficult to retrieve it. In the apical third, you can actually leave it as a retapulture and a filling material. But yes, we have to explain to them where exactly it is broken, how did it happen, and if any future repercussions of this mishap, we have to tell them that this can be rectified in such and such a form. Like we can do an section, or we can remove, we can redo the root canal treatment. We can bypass the instrument. We'll try to do that. So we should give an assurance to the patient that yes, separation of instrument is happened, but then we will take care of you. That assurance should be given by you yourself to by telling him what has happened.